It's nice to see such a big, energetic crowd this afternoon. My name is Pam Matheson. I'm here in lieu of Debbie Pearson today. I'm on the Wellness Committee. She's the chair of the Wellness Committee. She's off gallivanting with her husband in Switzerland and Europe right now, so she tasked me with this afternoon. I'm here to introduce Robin Gonzalez, who I think you have all met as new residents or as long-term residents, either one. Robin has a lot of her introduction in the presentation itself, but just to highlight that she's been here 16 years already, and about half of that has been as Director of Health Services. So she's going to share a lot of information about health services. I took advantage of her parents as new residents at the reception yesterday and asked them if there was any tidbits from her childhood that they'd be willing to share. And at the time, they were just kind of flummoxed about what to say, but her mother took the time to write some things down, hand it to her, to hand it to me. So she, like me, she loves black jelly beans. I do. And her favorite flowers are white daisies, although that is not a solicitation. And she and her mom often danced the tango together in the kitchen, so we'll have to see one of these dance nights, whether they do that for us.
When I was little.
Okay, well, still. So anyway, with those kind of lighthearted things, we'll get on with more serious information with Robin talking. Thank you.
Thank you. Does everybody have their cell phones on silent or turned off? Am I talking loud enough for the people in the back? Okay, great. If for some reason the microphone messes up or you can't hear me, just raise your hand and I'll talk a little bit louder. So thank you for coming. Yes, my name is Robin Gonzalez, and I've been here at Westminster 14 years. Maybe it feels like 16. I don't know if that makes a big difference, but yeah, 14 years. I am the Resident Health Services Director, so my job is to keep you healthy and safe in your apartments in independent living. Our managing company is Life Care Services, and so their branding style for my position in other communities across the United States is for my title to be a nurse navigator. So we're going to talk a little bit about what that is in just a little bit. So here's my family. These are my three little girls, Maya, Chloe, and Sophia. So Chloe and Maya up here on the left, they are twins. We rescued them from the shelter. And then Sophia, who is in all her glory, I rescued her from an independent living resident who was moving to a higher level of care because she was going to be taken back to the pound, and I didn't want that. So I did a little crying to my husband, and he let me bring her home. So she is my cuddle bug now, and I couldn't imagine life without them. This is me and my son and my husband. We went to the Museum of Illusions. That's an interesting place if you haven't been there. Some of it made me a little dizzy, but it was fun. And then this is my little family, my dad, my sister, her fiance, my mom, my stepdad, my son, me and my husband. So we have a little family, but we make it work. So I have a bachelor's in social work from Texas Lutheran University. I have a master's in nursing from UT at Austin. Together, those help me do my job here at Westminster. I've been here 14 years. I'm a certified dementia practitioner, which is the CDP. That's after my name if you've seen that in any emails. I've worked all levels of care. So I started out in the healthcare center, memory support. I dabbled a little bit in assisted living, and now I've been in independent living for 8 years. And then just on Tuesday, I was wrangled in to be on the board of the Educational Institute on Aging for Leading Age Texas. So this will be my first time being on a board. So if anybody ever has any advice, words of wisdom on being on a board, I would take those words of wisdom. So as the director, my job is to educate residents, families, and associates I serve as the clinic director, I answer emergency calls, I'm coordinator of the wellness check program, which we'll talk a little bit about, the yearly medical history updates. I also do the memory health assessments on potential new residents. I do tag team that with Rachel, so if I'm not available, then Rachel Gill will do those also. I also attend coordination meetings. In those coordination meetings, sometimes we talk about you. If your health is declining, or you're going to the hospital, you're going to have some type of procedure, you're in the hospital, we help coordinate your care. I help coordinate vaccination clinics. I'm your advocate. We talk about your goals for care. I coordinate the podiatry, so if you're with the podiatrist, I help coordinate that. I do agency coordination, and I'm on the wellness committee. It's not everything I do, but it's a snapshot. So as a nurse navigator, the ultimate goal is to guide you, your family members, or your care partners through successful health and wellness to keep you safe. I help build relationships, evaluate your needs. I help you solve issues that you may have in your apartment. I help coordinate programs, so that could be presentations, that could be, Terrytown coming in and doing vaccination clinics, that could be the podiatry. I help guide you through different programs and services that we have here at Westminster, and I facilitate communication. So that's communication from me, that's communication from other departments, that's communication about, I don't know if you saw the heat advisory information that went out. So that's my job, is to keep you informed of things that are happening. With all that, we make sure that all the education that is provided to residents falls into these 8 dimensions of wellness. So emotional, environmental, spiritual, vocational, social, intellectual, health services, and physical. We'll talk a little bit about this in my 3rd presentation, so I'm not going to spend too much time on this. Diane is my assistant. By a show of hands, how many have interacted with Diane? Good. So she is located in the clinic, but she is a notary, so if there's paperwork that needs to be notarized, if we're working on do not resuscitates, if we're working on the yearly medical history update, she gets all that paperwork together. She helps maintain your electronic medical records. Does anybody know Angie? She's our fitness coordinator. So she does fitness tests, she does demonstrations of the equipment, she leads classes, she's the expert in fitness. So, I work hand in hand with every department here at Westminster. There's not a department that I don't talk to, email, depend on, have to trust, have to negotiate with, have to depend on. My job depends on everybody that works in all these departments. I couldn't do my job without all of them. Does anybody know Rachel Gill? Rachel Gill, she's the Life Enrichment Director. So, we kind of have similar jobs. She's more social, mental, cognition, counseling, and I'm more medical. So we tag team on a lot of things. So if a resident is going through a medical issue, she may come to me. If they're going through a social cognitive issue, I may punt to her, okay? It takes a village. I can't do everything myself. There's 463 of y'all, and there's one of me. I do my best. I try to know everybody, but it is hard. So, I depend on every department and every associate. So, when you're in the dining room, when you're at reception, when you're getting your apartment cleaned, when you're interacting with other people, if there's any change in your communication, in maybe your behaviors, in your routines, sometimes those associates may come to me to report those changes. So say you go eat in the bistro every day at 10 a.m. and you order the same thing, oatmeal, raisins, brown sugar, glass of milk, every day, months and months and years, and you order the same thing, and then you stop coming to the bistro. Or you show up to the bistro when you're disheveled, and you haven't washed your hair, and you haven't taken a shower. So there's been a change in your condition. The bistro staff will notify me, and then I follow up with that. So I may follow up with you directly, I may follow up with indirectly, so monitoring, going to the bistro, kind of see what's going on. I may talk with other staff, so I depend on everybody, okay? If a housekeeper comes to your apartment and notices things don't look as good as they used to, hygiene may seem a little off, dirty clothes are everywhere, I'll have a conversation with that housekeeper and we may talk about services that you may need if things are getting harder for you. And then follow-ups are from me, possibly the clinic, or Rachel. LED is Life Enrichment Director. So I'm the director of the wellness clinic because, yeah, I have nothing else to do. So our wellness clinic has 3 nurse practitioners. 2 of them are dedicated to independent living, and 1 of them is dedicated to assisted living, memory support, and the healthcare center. We are overseen by a medical director, open Monday through Friday, closed for lunch. We're located over in the wellness area, so over by the salon, the bistro, therapy. When you arrive, sign in, have a seat, and the medical assistant will be with you. They can see you for evaluation and treatment of acute health problems or chronic conditions. We can do labs. We have an EKG machine, so if you're having some numbness, certainly the nurse practitioner can see you and do an EKG. If we see some abnormalities, we can certainly refer you to the heart hospital or to your doctor for further follow-up. They can see you for annual wellness visits. There's actually a clinic presentation next week on annual wellness visits. I think that's next Tuesday at 2 p.m. So if you want to learn about the clinic and annual wellness visits, you can come to that. They do wound care, vaccines, referrals for home health and therapy. If you need your blood pressure taken or your weight taken, you don't have to make an appointment. You can just come for that. You don't necessarily have to make an appointment, but they are encouraged because there are some days that fill up really fast, Mondays and Fridays. Mondays, they're following up from everything that happened over the weekend. Fridays, everybody wants to be seen because it's almost the weekend, or it is the weekend. So Tuesdays, Wednesdays, and Thursdays, more than likely you can be seen if you don't have an appointment. They have 3 presentations this year. Again, 1 next week, 1 in July, and 1 in October. We'll get the dates for that. Emergency calls. When a nurse is responding to an emergency call, we don't automatically call 911. I know a lot of residents are really concerned about pushing their pendant or pulling their pull cord because we're going to make you go to the hospital. We don't make you do anything. If our nursing judgment is to call 911, we may still call 911, but you have the final say, okay? We may call 911 to cover our nursing license and document that we called 911, but you can refuse to go out. Your family can refuse for you to go out, but we don't automatically have to send you out. So we're going to do our nursing assessment and give recommendations. Can a family member take you? Can a friend drive you? Is it okay to follow up with the clinic the next day? It just kind of depends on what we're there for. If you have an injury and you're on a blood thinner, if you hit your head, we may advise you to go out. If you get a significant laceration and we can't stop the bleeding, if you have a nosebleed and we can't stop the bleeding, we may advise you to go to the hospital. Our nurses can do CPR, first aid, education. We cannot give you medications. We can advise you on a medication to take. We cannot start oxygen. If you already have oxygen in your apartment and you just need assistance putting it on, we can help with that, but we can't start oxygen, we can't write prescriptions, and we can't do procedures like enemas. Please don't ask us to do an enema. And if a nurse comes to see you, I will follow up with you, or the clinic will follow up with you the next business day. If you're sent out by EMS or taken by a family member or a friend, we do follow up with you. If you're in the hospital, the next day that I'm in the office, I'm calling the hospital. I want to make sure, one, if you're still there or if you've come back to your apartment. So I get to work by 7:30, so I'm already calling the hospital to see if you're still there. If you are, I usually wait a little bit longer to call the case manager because they don't usually get until a little bit later. If you're not there, then I usually wait till after 8 to call you because sometimes you're still sleeping. But I coordinate with the case manager on getting you discharged, finding out what your diagnosis is, and are you coming back to your independent living apartment, or do you need a bed in the healthcare center? So that's one of my biggest jobs, is coordinating where you're going to go. How many people, I ask this every time, how many people, by show of hands, have on your pendant? Okay. Okay. So, I have to advise you to wear your pendant because it's safe, right? Right. I heard that somewhere. Some people wait to wear their pendant until after something bad happens. And then they learn their lesson that they need to wear their pendant. I know sometimes it's fashion not to wear it. You don't want it to clash with what you're wearing. You can hide it, yes. You can get a bracelet. You can get a fashionable necklace. There all are alternatives. I do suggest that you wear it, however. But it's independent living. You can choose to wear it or not. Push it if you need help, okay? Pull your pull cord if you need help. There's pull cords everywhere, okay? If you're needing EMS immediately, you know you need EMS. I'm going to be a little graphic. You've fallen, there's a bone, you can call 911. But then we still ask that you push your pendant or pull the pull cord, because there are things that we can do in the interim until EMS shows up, okay? If you have a fall or injury, activate your emergency system. Please don't hide the fact that you've fallen, okay? Because there are things that we can help you. Do we need to get therapy involved? Do we need to get the clinic involved? Maybe there's some changes that we can do in your apartment to make it more safe, okay? Just because you fall doesn't mean you move next door. I know people think that. There's not a 5-fall rule. I know that was the rumor that Robin made a couple years ago. There's not a 5-fall rule. But if you fall, I want to help you, okay? So if you fall, don't hide it from us. You may have other injuries that you can't see, or you may have pain that we can address. So let us know. If you see someone fall, do you push your own pendant? No, you push their pendant, or pull a pull cord that's in the vicinity, okay? If you push your pendant and you walk away, who are we looking for? You. We're not looking for the person that's injured. So push their pendant or pull the pull cord that's in the vicinity so security can come to that place. Security and the nurse are the only ones who should pick up a resident. And even security doesn't lift a resident until a nurse comes to do the assessment. Okay? I don't want you to get injured. Then we have 2 injured people. If someone falls on you when you're trying to help them up, then we've got 2 problems. Let me talk. about that. If you're needing the healthcare center, if you go to the hospital, I'm working with, so I go to a meeting Monday through Friday with the healthcare staff, with the assisted living staff, so we talk about people that are in the hospital, so yes, we talk about you. I talk to the admissions coordinator. We're talking about who's discharging, who's admitting, who needs a bed, who's coming back to independent living. So we're kind of playing chess with people. So I'm working on getting you a bed. I go to care plan meetings if you're in the healthcare center to talk about what your goals are, what the long-term care needs are. Do you need to stay in healthcare? Can you return back to your apartment? If you return back, what kind of care you need when you return back, or are you completely independent and you're great to return back and everything's fine? So we talk about all that. We are working with Preston residents right now doing their yearly medical history updates. The information that we get, or the information we have, is only as good as the information you give us. If you don't want to tell me anything, you don't have to. But if there's an emergency, I'm only as good as what you give me, okay? So in these yearly medical history updates, what I'm looking for is any changes in your doctor, if you've changed your doctors, changes in your insurance, if you've dropped anything, if you've gotten a new insurance, changes to your emergency contacts. So has anybody moved out of state? Is anybody new for your emergency contact? Has anybody passed away and you need a change? Your do not resuscitate status. A lot of people think their directives to physicians is their do not resuscitate status, but it's not. We'll talk about that in a little bit. And any changes to your medical power of attorney or your durable power of attorney. I think I'm down to 20 people who have not turned in a medical power of attorney. So I've got a checklist, and so I'm going through that. And I think there's just 20 people left out of 463. So I'm doing an audit and working on that. So also the correctness of the face sheet, so that demographics, I just need to make sure all that's correct. There's also a new questionnaire that Life Care Services, our managing company, wants my position in all facilities to do. So that's a new thing. Windsor and Carlisle have not seen that yet, unless you're a really new resident, because it's just rolled out in the past month and a half. But you'll see it at your next yearly medical history update. File of life. It's located in your refrigerator. It has your face sheet. It has your DNR form. It has your medication list. This is very important. Do we remove it from the refrigerator? No. This is where security and nurses know where to go if there is an emergency in your apartment. Okay? We do have a copy of your face sheet and DNR form, if you have one, at security, just in case something happens in a lobby or a hallway, but do not remove this from your refrigerator, please. Don't put it in your freezer, don't put it in a drawer, don't put it under your bed, don't put it in a shoe, just leave it where it is, please. Okay, advanced directives tells us what you want us to do with you when you can no longer speak for yourself. The directives to physicians tells us what you want when you're at the hospital or even in long-term care. So do you want a feeding tube? Do you want to be kept comfortable if you're in pain? Do you want a breathing tube? It's kind of that information. A do not resuscitate is, do you want us to try to restart your heart if your heart stops? So technically, you're deceased, and we will try our best to bring you back to life. I'm working on an audit to check everybody's full code versus DNR paperwork, and then I'll be reaching out to residents to talk about that. Some residents that are younger and healthier want to be a full code and want us to try everything. So they want CPR, they want rescue breathing, they want us to call 911 and get them to the hospital as fast as possible. Some people, if their heart stops, they are good with their life, they've traveled, they're okay with that natural death, and they're a do not resuscitate. So if you have questions about what we have as your status, please don't hesitate to reach out. This is the form that we have to have if you want a do not resuscitate, okay? If you have one of these that your lawyer filled out, or your son or daughter, or the mailman, or anybody besides Westminster, please let me know, because a lot of times they've done it wrong, and EMS will not accept it, okay? So if you have questions, if you want me to check your file, let me know and I can do that.
What does that mean? I mean, if you're fairly healthy, then they have
So do you want us to do CPR and try to bring you back to life?
over and over again, no, but one.
You've got to pick one or the other. Well, that doesn't work anymore. Okay. Guess I'm reading from here. Or not.
What, in addition to CPR, is a full code?
So we would start CPR, so I'm doing chest compressions. We would get an AED and put that on you and see if it reads to shock you. We call 911, EMS gets here. They would insert a breathing tube. They're gonna inject you, they're gonna start an IV, inject medications like adrenaline and try to bring you back to life. Continue doing chest compressions and try to get you to the hospital. So,
But in the process, they can say, she or he's gone.
yes,
Okay.
but that's after a lot of trauma to the body
Usually broken ribs.
and punctured organs, yes. If you have a scooter, register it with my office. We have everyone complete occupational therapy training so that you learn how to transfer on and off your scooter, navigating the hallways, your apartment, and elevators. Also, if you have a walker, please do not have anybody push you in them. So if you're sitting on it, don't have anybody push you backwards, because then you fall, hit your head. We've had that happen to a couple of residents and you can get a brain injury. If you have a pet, register them with us. They get their own pet vial of life. So they get their own little medicine bottle in case something happens to you. We know how to take care of that pet, and not forever. We know who to call to help take care of that pet. Robin can't adopt anymore either. So don't put me down as the contact person. Exercise classes. If you have ideas for other ones, we're always looking to change those up based on resident participation. You can always suggest something. I work with, so this is outside people that I work with, so Select Rehab, that's our therapy company, home health companies, nutrition management, so the nutritionist in the healthcare center can meet with you to talk about nutrition and offerings in the dining rooms. Pharmacies, care managers, hospices, hospital case managers, your family members, and caregivers as needed. in your apartment. You can have wellness checks, personal service providers, agency, home health. You can have hospice in your apartment, therapy. We have a program called Wellness Checks. So this is certified nursing assistants. This is a complimentary program that is usually only for 2 weeks, usually up to 3 times a day, 30 minutes a piece. They can assist with, if you're returning from the hospital, or say you have the flu, or you're coming back from healthcare. It's temporary help just to get you stabilized in your apartment. If you're needing care longer than that, then we would talk about you hiring someone to assist you in your apartment. So this is just to help you through that acute time. But if you're needing more care, then we talk about that. They can do vital signs, some medication checks. So maybe you're on an antibiotic for 7 days and you're having difficulty remembering to take that. They can come in for 7 days and remind you to take that. And then afterwards, maybe you don't need them anymore. Do some pet care, showers if it's an emergency. Personal service provider, you can hire someone to help you in your apartment to maintain some independence. Maybe you're finding it difficult to get dressed in the morning, or it's taking you so much energy to get dressed that you're tired the rest of the day. In one instance, we had a resident who it took him 45 minutes to get dressed in the morning, and after that he was pooped, and he couldn't do anything else. So I talked to him. He hired a caregiver. The caregiver could come in the morning. Within 20 minutes, he got dressed, and he had energy for the rest of the day. So sometimes just that energy conservation, having somebody for 20 minutes, he was good for the rest of the day. Sometimes you just need someone to come in and remind you to take your medications because it's hard to manage your medicine. So we talk about what your goals are, what your needs might be, and we go from there. If you hire someone completely off the street, which I don't recommend, but it's someone who doesn't work for an agency, there is paperwork to fill out. If they work more than 10 hours a week, they can get a fob that has access to our outside doors, and they can get a parking sticker and park in our Carlisle garage. But they have to do a TB test, and they have to do a background check, and they have to register with AccuShield. And this puts the responsibility on the resident and the family member. So if they get hurt in your apartment, or they take advantage of finances or payments, things like that, Westminster has no responsibility in that at all. Our preferred provider is Halcyon. You don't have to go with them, but they are our preferred provider for private duty, home health, and hospice. I do have additional agency recommendations if you need them. For private duty, they can help you with anything: bathing, companionship, showers, pet care. They can drive you places if you need a driver. Again, this is paid for by the resident. Home health, this is where a nurse follows up with you. It could be after a hospitalization, if you have significant wound care, changes in your medical condition. So this is an order that's written either by the hospital when you're discharging, or by your doctor, or by the clinic, and that nurse would follow you just to make sure your wound care gets completed, or they give you education on your new diagnosis. Hospice, this is end-of-life care. Again, this can be done in your apartment. We've had several residents who have had hospice care in their apartment. They can assist with getting a hospital bed, oxygen, comfort medications, where you can stay in your apartment and you don't have to move to higher levels of care. If you do have to move to higher levels of care, that transition is pretty smooth, because they also take hospice in the higher levels of care. So that transition is good. Select rehab, physical, occupational, and speech therapy. You just have to get orders from your doctor or the clinic. Now, if you're finding it harder to button your clothes, walk long distances in Westminster, you think your strength isn't as good as it used to be, and you want to talk about this, just let me know. We can talk about this. We can get orders from your doctor, and therapy can work with you in your apartment or the therapy gym. Your physician, here's a therapy question that I get from residents quite a bit. Your physician gives you a prescription for physical therapy. Do I have a list of recommended services in the area if you don't want to use Select Rehab? I can give you some recommendations. I do have those in my office. Most residents go with Select Rehab just for the convenience, because you just have to walk down the hall or they come to your apartment, but I can give you some options. What procedures do you follow to get on their schedule? You can bring that order to me, or you can take it to the clinic. My assistant Diane verifies your insurance, then she emails that information to Select Rehab, which is right across the hall, and then Select Rehab reaches out to you to set up that evaluation. And that's all you need to do. Okay, these are our higher levels of care. So the Arbor, they have the healthcare center, which you may see as HCC, you may see it as long-term care. There's lots of names that it's called. It's on the second floor of the Windsor. They also have skilled nursing. You may hear it called SNF or rehab. That's on the first floor of the Windsor. We have assisted living and we have memory support. So Westminster's goal is for residents to stay as independent as possible. So there are things that we try to keep you in your apartment. We like you to try to age in place as much as possible, but everybody's goals are different. Some residents have moved into Westminster so that they can stay in their apartment till the end. They never want to move. They want to stay in their apartment surrounded by their things forever. Some residents move into Westminster in independent living, and as soon as they can do something for themselves, they want to move to a higher level of care. Everybody's goals run that gamut of what they want to do. So my job, one of my jobs, is to find out which goals you have, and we make a plan for what you would like to do. So with me, we start the conversation, I do some fact finding, we discuss goals, options, and transitions, so we talk about the big picture of what the options are. It is an interdisciplinary team, family, and resident decision, unless you're a harm to yourself or other residents. If you're a harm to yourself or other residents, then Westminster can insist on a move. Once we get to where you need to move, or you want to move, or a move is inevitable, we continue that conversation. We talk about a tour. There's assessments that have to be done. The Arbor, the healthcare center, does not have walk-in services, so you can't have a cough, show up to healthcare and say, admit me, I'm staying for the weekend. We don't do that. It's not a hospital. There are things that we can do in independent living to help you with things like that. We have the nurse practitioner clinic. We have wellness checks. We can help you. These are the things we look for moves to higher level of care. So poor hygiene, incontinence that cannot be managed. Of course, with all these, if you put in care, then certainly you can stay in independent living. Falls with major injury, uncontrolled pain, losing weight, unable to get food or eat, unable to transfer yourself, belligerent or abusive to others, unable to use the emergency system, wandering or lost inside the building or outside. And you can stay in your apartment as long as you're safe to do so. We talked about this a little bit on after hours. So if you need a doctor after hours or on weekends, everybody's medical doctor has after hours care. So I would put this in your phone, the phone number for your doctor to call after hours and on weekends. Our clinic is not open after hours and on weekends. Again, use your pull cord or pendant. You don't have to go out to the hospital if you don't want to. And then urgent care, your friends or your family could take you. These are just some questions that I've gotten from some other residents. I'll make these quick so we can have some question and answer. You have concerns for another resident, what do you do? Let me know. Usually we already know that that resident is having some challenges, but if you do have concerns, you can come talk to me. I can't give you any information, but I can thank you for letting me know. okay? Everything is a process, so if you let me know, I'm just gonna throw this name out there, Miss Smith is having difficulties, and you tell me what those difficulties are, I do make note of them, and I do just say thank you for letting me know, but we're probably already working on a plan with her. Remember, it's a process. It may seem by an outsider that it takes a long time for movement. Sometimes it does. We're working to get family on board. We're trying everything we can. The clinic, labs, therapy, caregiver. Sometimes family is in denial. Maybe they only come once every 6 months. Maybe they only stop by for 10 minutes, and some people can hide cognitive issues for 10 minutes. So they don't understand what we're seeing. Mom's fine. Mom can find her way to the bistro. Mom doesn't need anything, but we're seeing something completely different. So we have to document, we have to prove our case to the families of why they may need more care or move to a higher level of care. You're planning on having a major surgery, do you let me know? Yes, please. If you want my help. And the sooner the better, because I have a radar list. If you call me on a Friday at 4 p.m. and say, Robin, I had hip surgery, I'm being discharged, what are you gonna do for me? It makes it a little bit harder. But if you tell me a week, 2 weeks in advance, then we can make a plan for you. We can talk about options, we can get things in place. If you're gonna have an outpatient procedure, so colonoscopy, a Mohs procedure, dental extraction, do I inform you? Sure. It's not as critical as a major surgery, but sure. Dental extractions, we've had some residents have major dental surgery, come back, it starts bleeding. If we know in advance, we can have checks put in place, we can make sure you have soft foods, we can do some education with you. Again, I'm only as good as the information you give to me. I can tell you about our services, everything that we can help you with, and everything that we can do if I have the information. If you have anesthesia or other twilight medication, do you stay with me? I don't. I like to go home. And our wellness aides will not stay with you 24/7. So if you want someone to be with you 24/7, either a family member has to stay with you or you'd have to hire someone to say, we can do checks if you're okay with that, and you have your pendant, you have your full cord, but we can't stay with you. You're ill over the weekend, I call my physician, he recommends a prescription, I don't drive. Employees cannot pick up your prescriptions. We're not liable for that. So you can ask a friend here, or you can ask a family member. You can have a pharmacy that delivers. Some residents have a backup like Terrytown that does delivery for things just like that. My next presentation is June 11th at 2 p.m. If you got one of those handouts, I think on the back it lists the presentations. If you want to come learn about emergency procedures, weather, and health, how to stay independent and independent living. So we talk about those things earlier, just a little bit more in depth, everything that we do for depression or falls or major injuries. We just go in more depth about that. Assisted living memory support, August 5th is their presentation, so come learn about assisted living and memory support. The Arbor, long-term care and rehab, September 10th is their presentation, so come and learn about that. The clinic has a presentation next Tuesday about annual wellness visits, so you can take advantage of that. COVID, colds, and flu is in July, I don't have a date yet. We do this every year, and then clinic services in October, so everything that they offer. Every resident situation is different. We can discuss options that fit your goals. Thank you. Any questions? We have a question back there.
Robin, I just have a quick question. A couple of months ago, or a couple of years ago really, I was here and I got up in the middle of the night, about 2 in the morning on a Saturday, fell forward, hit my head on the corner of a dresser and was bleeding profusely. I went downstairs and talked to the desk, and he said, go to urgent care. And there I was.
Yeah. So,
Well, I know you did say call your doctor. This is 2 o'clock on a Saturday morning.
yeah.
AM, 2 AM Saturday morning.
So what I would have, is this one working? So what I would have done is stayed in your apartment, pull the pull cord,
Mhm.
security comes up, they radio for a nurse. So I would have had a nurse come evaluate you because they can do an assessment. They probably would have said go to the emergency room because you don't know what kind of head injury you may have had.
And in that case, you'd have to have somebody drive you. I ended up driving myself.
I wouldn't do that. There goes my eye. I wouldn't do that because you possibly have a head injury, or if there's a laceration, what if you pass out at the wheel?
But when I went to the desk, he just said go to urgent care. He didn't recommend calling a nurse or anything.
So sometimes we have to educate other people in other departments. Yes,
Thank you.
you're welcome.
Yeah.
You could call EMS.
You can also call EMS yourself, yes.
Okay, if EMS takes you to the hospital and your family's out of the country, how do you get back to the Westminster?
So there's different ways. If it's not during our transportation times, they can arrange transportation. So they could do, if you're in an assistive device, they could call a company like Acadian that has transportation for assistive devices and help get you back. If it's during our transportation times, then we could send one of our buses to come pick you up that have the assistive device modifications.
Okay, thank you.
So it's conversation. So you could call me, you could call the clinic, you can call the front desk. You could let us know.
Okay.
Yeah, but the
thank you.
hospital, I mean, they deal with people out in the community. How do they get those people home? The same way
thank
they
you.
can call transportation services.
If you were scheduled to have a procedure with anesthesia proposal, and they say to you, you cannot be discharged unless there is someone here that will take you home. Also that will receive our instructions. Do you, and I'm not talking about taking you in the morning and staying throughout the whole thing and waiting. I'm just talking about the pickup and delivery part of it. Do you supply
No,
anything like that?
we don't supply that because then we would have to take responsibility for you, and we won't do that. Our drivers won't do that. You would have to hire someone to go with you that will sign for you.
And those would come out of a nursing agency?
Mm-hmm.
Okay, thank
Yeah,
you.
and I can give you recommendations for that. And you would need to do that in advance, not call them the day before. You would have to give them some advance notice.
You mentioned many times that you would be in contact with the hospital to discuss a patient's case.
Yes.
Do we need to add you to the HIPAA form so they'll talk to you?
No, when I call them, I tell them who I am, and they're fine talking with me because I'm considered a case manager, so they talk with me. Mhm. They freely give information. Yeah. I've never, in the 8 years I've been doing this job, I've never had them ask for a HIPAA release for anything. Yeah. Anybody else? I'm going to, this has been recorded, so if anybody says, oh, I missed our presentation, or you want to re-watch it, or you missed something, it will be uploaded to the portal. The PowerPoint will be uploaded to the portal, and then this little handout will be uploaded to the portal. If somebody didn't get the handout, I can write down your name and get it to you. Oh, one more.
Robin, we've been here 8 years now, and we've been with two persons late at night in hallways who were either had a fall or something like that. In each case, of course, the guard came, and eventually a nurse came, but later at night it's not always immediately. And it's the protocol is the nature of my question. They have a protocol, and part of that is we can't lift anybody and help them get back to the room. But the guard kept saying, you have two choices. You can go to your room, or we can call 911. What do you want to do? And in each case, the person didn't know. They wanted some medical advice. And I have a doctorate in philosophy, but that wasn't extremely helpful at this point. I could tell her what it meant, but not what to do. But in that protocol, sometimes even when the nurse came, I've never seen a nurse do any emergency work on anybody other than take their temperature and take their pulse. So would a nurse say, I think you should go to the hospital?
That's part of the nursing assessment. They can
Okay.
give their recommendations, but we cannot force you to go.
No, but you can give medical advice.
We can say, in our nursing opinion, you should go into the hospital because of this, this, and this. But
And then that would
ultimately,
be a 911 call.
correct.
And in the meantime, it's 10, 20, 30 minutes have passed. Yeah.
It could, it
Yeah.
could.
So I just want to make clear about the protocol and whether they know that they should give medical advice. to
They
the
can give
people.
nursing advice.
Yeah, because the people say, do you think I need to go to the hospital? And there's an awkward silence.
It depends on the situation.
Yeah, okay.
Yeah, yeah.
All right. Thank you.
Anybody else for questions? From the back.
Is the night nurse an LPN or an RN, and how much experience does she have?
It depends on who's on staff at the healthcare center. So during the day, Monday through Friday, I'm on duty from 7:30 to noon. And then from noon to 4, the assisted living nurse is on duty. And then in the evenings and weekends, it's the healthcare center. So it depends on the nurse that's on duty.
So is she an RN though, or is she an LPN? Or?
Depends on who's on duty.
Oh,
So it could be an LVN, it could be an RN. It depends on who's working that shift.
Could it be a nurse practitioner?
It's not a nurse practitioner.
so that makes it a little bit difficult if it's an LPN and she doesn't have a lot of experience.
I mean, some of them have 15, 20 years experience.
Sorry?
Some of them have 15, 20 years experience. I mean, it just depends on who's working the floor that night.
Okay.
Yeah,
I'm just curious.
Yeah.
Thank you.
yeah.
Okay, any other questions? Well, I think we want to give Robin a big round of applause for her presentation. And like she said, the presentation will be on the portal. We really would appreciate if you fill out the evaluations and leave the forms and your pens or pencils. They'll be collected toward the back as you're leaving. Thank you.